Very good.
If you want to hang ribbons on your trees.
Excellent. And I know we're going to be doing a proclamation later tonight at our council meeting. So, and this will be aired, TV 36 not only aired here in Westfield, but throughout Union County. So a lot of people will be learning more about ovarian cancer. So Lynn, I know it's called a silent disease. What are some of the symptoms?
Well, some of the symptoms are bloating, pelvic pain or abdominal pain, difficulty eating a small amount of food and feeling full quickly, sometimes leg pain, back pain, urinary frequency, and urinary incontinency. And the problem with the symptoms for ovarian cancer is that some of these symptoms are the same symptoms as other abdominal difficulties. And when a woman might go to a doctor, the doctor will take a look at some of these symptoms, and she might be diagnosed as having very commonly irritable bowel syndrome. And the problem with that is if the difficulty really is irritable bowel syndrome and she takes medicine and she feels better, I'm really happy for her. But what we would like women to know is that if you have some of these symptoms, you go to a doctor and you really don't feel any better, maybe after taking some medication, we would like women to really think that ovarian cancer could be the answer to all of your symptoms, because it's so important for women not to let these symptoms just go, because unfortunately ovarian cancer grows very quickly. And so you can move from early stage disease to a stage 3 or stage 4 in a matter of a couple of months. And so if you are having difficulty or having some of these symptoms, we from the National Ovarian Cancer Coalition really urge women after a couple of weeks to seek medical care and to keep seeking medical care. Many of the women really do realize that something is wrong, but they cannot put their finger on what it actually is. And you hope that you would get an accurate diagnosis when you go to a medical professional. Sometimes that really doesn't happen, as evidenced by some of the women who are volunteers in our chapter. So what we'd like to do is have women realize, with the symptom cards, with our bookmarks, with some of the information that's on the website for the National Ovarian Cancer Coalition, that if you have these symptoms, please check them out and keep checking them out, especially if they have an inner spirit or something that's telling them that something is wrong.
And to add to that too, a lot of people are under the assumption that pap smears check for ovarian cancer, and they do not. Actually, when I was diagnosed, my pap smear was completely normal, and I had a 9-centimeter tumor on my ovary. So, pap smears don't give you a clear that's detecting for cervical cancer. And again, I was very active. I was playing tennis 4 days a week, was running around like nothing, but had urinary frequency, and then went for my annual exam, and I had been to a doctor 6 months prior, and it had grown within 6 months that quickly. So it's just going, whether you're feeling symptomatic or not, making sure you go to the doctor. Literally put it on your calendar, book your appointment. When you go, you book it for next year. Because had I waited 3 months, I might not have been so lucky.
The problem is the symptoms you mentioned, a lot of them just come with life and aging.
Yes, they do.
Exactly.
And so once you start getting a symptom, is it chronic or is it more sporadic? I mean, if you have, let's say, back pain and it's related to ovarian cancer, would it just happen occasionally, or once it starts, does it stay?
Well,
with,
back pain
with the patient?
is probably a rarer kind of symptom, but let's take for example bloating. Bloating is a really common symptom of ovarian cancer, and usually it is bloating that comes and stays. So that most of the bloating will occur in the abdominal region because some of the ascites that's occurring inside the woman's body. It's a fluid that's given off by the cancer cells. There's no place for the fluid to go, so it kind of builds up in the abdominal cavity, and that then would continue to get bigger and bigger. Many times the waistline on a woman's garment will become tighter and tighter, and that's a symptom. So it's not something that comes and goes.
So one of the acronyms to remember the symptoms was BEAT, right? B-E-A-T.
Mm-hmm.
And so that stands for bloating.
Yes. Eating a small amount of food and feeling full quickly. Okay, the A is for the abdominal pain.
T, trouble with your bladder.
Okay.
So those are all symptoms, but the most important thing is to get yearly exams.
Right.
So what are some of the risk factors? Are some women more prone to getting the disease than others? And if so, what are those factors?
Right. Some of the risk factors are increasing age. That is really a risk factor. And sometimes women who are of Ashkenazi Jewish descent have a greater probability of having ovarian cancer. And women who have never had children are at risk of developing ovarian cancer. But let me say this: any woman is at risk for
So
developing
I was going to
ovarian
say,
cancer.
and I don't fit into any of those
Right.
categories, so.
And even with increasing age, ovarian cancer used to be known as an older white woman's disease, but in my work with doing PowerPoint presentations and going to health fairs and talking to people about ovarian cancer, there are women who are in their 20s and 30s, any age group. I found women who have really had to deal with ovarian cancer. And unfortunately, I've also heard of a woman who was pregnant and after her son was born, had to deal with ovarian cancer. So none of us are really safe from not developing ovarian cancer.
So the important thing is to have annual tests because it's a very fast-growing cancer.
Right.
So what are the diagnostic tests that are out there now?
Unfortunately, there really is no diagnostic test that can be used for ovarian cancer. As Joe mentioned before, many women think that because they have a pap test, that then they will come up to me and say, I'm clear, I'm not going to get ovarian cancer because I've had a pap test. And those are two entirely different cancers. The pap test is for cervical cancer. Ovarian cancer has no diagnostic tool or test at this time. So that's why a woman really has to be aware of what's going on inside of her body, bring the symptoms to the forefront of her medical professional, and then in conjunction with her medical professional, there is a blood test that she can have called the CA-125 test. She might have a CAT scan to see if there is an ovarian mass growing, which is what I had in my case, because I unfortunately or fortunately did not have any of the classic symptoms of ovarian cancer. But I did have another symptom, which was after urination, I would feel a tightness internally. And I knew that this was not right for my body. And so I really pursued it through several doctors until I had a CAT scan. And I found out that I had an ovarian mass on my left side, but it was only when I was in surgery did they discover that it was ovarian cancer on the inside of this ovarian
And that was the
mass.
same with me too.